It is my honor to introduce our first speaker, Her Royal Highness Princess Dina Mired of Jordan, who will be providing this morning's opening remarks. Princess Dina is a well-known and passionate global advocate for cancer control and non-communicable diseases, and the mother of a cancer survivor. She's also president of the Union for International Cancer Control and a special advisor to Vital Strategies. It's a privilege to have her with us, and with that, I'd like to hand it over to you, Princess Dina.
Thank you, Nina. Let me just get that going. Dear friends and colleagues, good morning, afternoon, and evening to you all. It is my pleasure to also welcome you to today's Vital Talks, A Recipe for Health, the Urgent Need for Food Policy. I was honored to present last year at this Vital Strategies-led event when it was held on 42nd Street in New York City, only a few doors down from the United Nations. Little did we know that by January 2020, the world would change drastically and dramatically. COVID-19 quickly spread throughout the globe, resulting in the deaths of hundreds of thousands of people, creating widespread health, economic, and social instability. Ironically, whilst the pandemic required us all to wear masks to protect ourselves, the pandemic actually unmasked many of the vulnerabilities that already existed in our health system and further exacerbated them. We, as a global health community, have long spoken about the link between obesity and non-communicable diseases. As we speak, over 2 billion people, nearly 1/3 of the world's population, are overweight or obese, noting that undernutrition and obesity are often opposites of the same coin, as people increasingly consume cheap, ultra-processed food and drinks, which lack nutrients but are dense in fat and calories. Such unhealthy diets are estimated to be responsible for 11 million preventable deaths globally per year. The COVID pandemic has brought new urgency to the need to reform our food system and our food environments. COVID-19 brought food insecurity, malnutrition, and obesity to the forefront. During the pandemic, we saw how many in the processed food and beverage industry, as well as other unhealthy commodities like tobacco and others, utilizing the pandemic to further their own commercial interests under the guise of either CSR, donations, or by adapting their marketing efforts to link themselves with the pandemic health efforts. Donations from processed food companies to frontline health workers even made major news headlines. There were many other tactics by the food industry to capitalize on the pandemic. Many organizations in the NCD health community warned about corporate capture of COVID-19. Furthermore, with continuous lockdowns, closure of grocery stores, and high-end restaurants, the industry mobilized quickly to make it so much easier to access such unhealthy foods. Other commodity industries even managed to include unhealthy foods such as alcohol as an essential food item during the first wave of lockdowns during the pandemic. Others even managed to include cigarettes, can you believe it, as an essential food. I have unfortunately seen my own children increase and expand their takeaway fast food orders during the pandemic. Even before COVID-19, the urgency of food security was being debated. Now we fear that COVID-19 will have already intensified hunger, undernutrition, food insecurity, as well as obesity across the globe. That is why on the 75th anniversary of the United Nations, it has become extremely crucial for us to discuss the urgency of promoting access to safe and nutritious food by using effective food policies. Food environments determine food security and also strongly influence customer behavior, including encouragement to overconsume calories. It is people's right to have a food environment that fosters their well-being and not their vulnerability to non-communicable disease. And we also need a food environment that does not overtly target the poor, the very people who cannot stomach neither the cost of empty calories nor the burden of an ensuing NCD disease. In the past, we mistakenly placed the full burden of following a so-called healthy lifestyle on the individual. Lifestyle changes give the impression that it is a matter of choice or preference, but when people are bombarded with processed food and drinks that are more affordable than healthy options, it becomes not a lifestyle choice, but a life sentence. Furthermore, processed food companies tend to present their products with labels at the back of the product with minute, unintelligible information and at times misinformation about its nutrient content, thus making it difficult to decipher the actual goodness of the product. Taking in mind the 41 million children who are obese and malnutritional right now, a clear and transparent response by government is what is required urgently to arm people with the right and easy to understand information of what exactly they are consuming so they can make the right informed choices. As per a new report released today by Vital Strategies called What's in Our Food, offers a step-by-step guide to governments and policymakers on the need to introduce effective front of package nutrient labels. After all, we have clear labeling of the material used on the clothes we put on our bodies. It is inconceivable that we are denied that same easy to understand information about the food we put in our body. We have to increase promotion of access to safe and nutritious food to nullify or at minimum equalize the extensive misguided promotion by industry of unhealthy foods. Governments and policymakers have to recapture the food security narrative if we intend to capitalize on the current focus on health to build back better. We simply cannot let corporates nullify the gains already made by the health community. Not seizing on this opportunity would be a recipe for disaster. Thank you very much.
Thank you, Princess Dina, for those incredibly insightful and powerful remarks. I think you've set us up perfectly for a really stimulating conversation. So let's continue with today's program by introducing our panelists. If we could have all of our panelists, please turn your videos on. Excellent. So first, I'd like to introduce Dr. Tlaleng Mofokeng. Dr. T, as she's affectionately known, is the newly appointed UN Special Rapporteur on the Right to Health. Congratulations, that's a very, very new appointment, I understand. And we're so privileged to have you with us today. She is a medical doctor living in Johannesburg, South Africa, and comes with expertise in sexual and reproductive health. Next, we have Dr. Fabio da Silva Gomes. Fabio is the Regional Advisor on Nutrition and Physical Activity at the Pan American Health Organization. His work focuses on linking knowledge, policy, and action to promote healthy eating practices with a view towards social justice and equity. We also have with us Professor Barry Popkin from the University of North Carolina's Gillings School of Global Public Health. Barry is an economist whose research focuses on nutrition, obesity, and programs and policies that can improve population health around the world. Also joining is Dr. Nandita Murukutla, who is Vice President of Global Policy and Research at Vital Strategies, where she leads research on the social, behavioral, and political factors that affect the success of health interventions, including in food policy. And last but not least, we have Mr. Jewell from UNICEF. Joe oversees UNICEF's nutrition sector's global pillar of work on childhood overweight and obesity prevention. He comes with experience in a range of food policies, including a focus on food marketing to children, nutrient profiling, the use of price policies, and infant and young child feeding. Thank you all for being with us. Let's jump right into the questions so we make sure we've got time to take some audience questions as well shortly. Dr. T, I'd like to start with you. You have an incredibly inspiring background of fighting for reproductive justice and ensuring reproductive health care is available to everybody, including the most marginalized, especially the most marginalized. You've recently stepped into a new role as UN Special Rapporteur for Health. On the surface, it may seem that there aren't parallels between reproductive justice and food justice. Those are issues that I work on. I work on both of those things, and I believe there are parallels. I realize you're just getting acquainted in this new role, but wondering what lessons you think we can apply from the reproductive justice movement to the food justice movement, especially in the context of the pandemic, when more and more people, particularly those that were already most vulnerable in the pre-COVID era, face challenges in accessing nutritious food.
Thank you so much for that. And I think it's so important, especially, as a physician myself and someone who's been an activist in South Africa for many years. Often we talk about, the very clinical situations and context and conditions, and not really pay enough attention to what else is needed in terms of a society of a healthy person beyond biomedical solutions, right, to some of these health conditions. And it's so important, some of the issues that I have come in contact with, for example, you speak about the issue of reproductive justice. Reproductive justice is not just about the right to decide when, if you want to have children and how to have children and how many to have children. It's also about those children living in societies that are going to enable them to thrive, and access to nutritious food is a big part of having populations that are thriving, right? It's also important to think about the continued issues around stunting in children and the fact that vitamin deficiencies continue to be a big problem. We can talk about even maternal health before and during pregnancy, and how a lack of access to nutritious food, even for pregnant people, has links to low birth weight babies, and what that then does to the newborn mortality rate, for example. We can even talk about just the importance of having chronic illnesses like diabetes, hypertension, HIV well managed. A lot of patients need access to food before they can take their medication. So it's so important to realize that as we are diagnosing, as we are coming up with clinical solutions and biomedical solutions, there are other factors that determine health outcomes, and access to good nutrition is important. And COVID, unfortunately, finds the world already quite strained with very marginalized populations already experiencing food insecurity. So it's about how we advocate for programs and policy that can be decisive and lead to positive action and outcomes.
Thank you for that. That was a brilliant response. And I think we're all so excited to have you in this role, and really look forward to working with you further. I think your response, it really, if I could summarize, we really are what we eat. It impacts every moment of our lives. So thank you for that. Next, I'd like to turn to Joe from UNICEF. Joe, the COVID-19 pandemic has brought food insecurity, malnutrition, and obesity into the forefront. Can you expand a little bit more on what you're seeing and what opportunities you see to advance the healthy food policy agenda?
Sure, and thank you very much for that question, and also thanks to the organisers for the invitation to be here on behalf of UNICEF. I think as the speakers before have already alluded to, I mean, we're facing this unprecedented global health, social and economic crisis, not only from the virus itself, but also the strategies to respond. So the actions that governments are putting in place to mitigate the virus, including lockdowns, physical distancing and school closures. UNICEF sees actually a huge risk for the nutritional status and survival of children as a result of this pandemic, of course. And as Princess Dina Mired alluded to, this also threatens children's rights. And I think as the focus of our discussion today is, what are the opportunities, the urgent need for food policy? I think COVID-19 has exposed, on the one hand, the elevated risk that people living with obesity face to a number of issues, but including COVID-19 as an infectious disease. And so it's, as you said, put emphasis on the need to take action to prevent overweight and obesity, but also thinking more broadly for low middle income countries, given that unhealthy diets are an issue in low middle income countries, but they're facing a double burden of malnutrition. It's also made us the challenge of addressing all forms of malnutrition through joined up action even more important. And to be clear, UNICEF is looking at all forms of malnutrition, and we do see that COVID-19 and the response is threatening all forms of malnutrition. We do expect it to have a negative impact on diets and risk factors for overweight and obesity. And some of the emerging data, whilst it is relatively limited at this stage, we're starting to see data coming out from studies we're conducting with children around ultra-processed food consumption going up, snacking behaviors. Of course, physical activity has been impacted. And let us also not forget the infant young child feeding. We're seeing, for example, from Mexico, that breastfeeding practices are being undermined and that food insecurity is going up. So just to sort of put out the opportunities that we may have moving forward, I think in high income countries, it's clear that there is an opportunity out of this horrible situation, that it has put some emphasis on the need for wider policies, and also expanding from childhood obesity to also include adult obesity, and the need to also address that. And the UK is an example, I think, of a country that has actually been able to push forward more progressive policies against a quite difficult background. In low middle income countries, it could be more challenging, remembering that they have so many issues on their hands, not only all the other forms of malnutrition that they still need to address. We're still seeing progress, and I think some of the speakers afterwards will talk about the progress we're seeing in places like Latin America. But elsewhere, perhaps the food policy agenda is a little bit more fragile. We need to reinforce it moving forward. And I think, just very briefly to talk about sort of some strategies that we could put in place to act on all forms of malnutrition, including overweight and obesity. Let's not forget maternal, infant, young child nutrition, the need to protect breastfeeding. Let's not allow COVID-19 to undermine breastfeeding and allow violation of the International Code on the Marketing of Breast Milk Substitutes. The access to healthy food part, we're seeing the availability and affordability of healthy food being threatened. We need to look at the solutions, how to make sure retailers are offering healthy food, how do we make sure that safe markets are available for fresh food, community kitchens, for example, to reach the vulnerable communities facing multiple forms of malnutrition, school food, how do we provide healthy food in schools or through alternative mechanisms when schools are not in place, the social policies, expanding protections to reach people who have lost their income, are really struggling, and make sure that that's only healthy food. I think one of the speakers mentioned around, we shouldn't be distributing unhealthy foods, and let's not delay the regulations to address the promotion of unhealthy food. Let's keep the focus on it. Let's get those over the finishing line as well. I'll stop there. Thank you.
Thanks very much, Joe. There's a lot to do, but as we'll hear shortly, there are things happening. So moving on, Barry, my next question is for you. You recently published, along with colleagues at the World Bank, a paper that examines the link between obesity and poorer outcomes of COVID-19. Can you describe for us some of your findings and what your conclusions are, and what advice do you have for governments? Barry, you're muted.
Certainly. The study was done with colleagues from the Saudi Health Council, which funded this, and the World Bank and our UNC team. We first did a very comprehensive meta-analysis looking at all phases of testing positive for COVID all the way through to mortality. And there were three really surprising results. First, we found that more than double, that is 113% more likely, among individuals who tested positive, those who are individuals with obesity were that much more likely to be hospitalized. Second, among all those testing positive, individuals with obesity were 74% more likely to go into an intensive care unit, an ICU. And lastly, 48%, or almost half, were more likely to die compared to other individuals. So that was the first thing we saw. The second thing is we looked at all the pathways, and one of the things that was unique about our very detailed analysis of the ways individuals with obesity are affecting their health in this whole process is that individuals with obesity, we know from 2 different coronavirus vaccines, the flu vaccine with extensive studies and a little bit from some of the preliminary SARS vaccines, that both these vaccines were much less effective among the obese, partly because of all the immune functions affected with individuals with obesity. So that while we know it'll work, it won't work as well. And we want governments and researchers to look at this and think of ways they can boost the effects for such individuals as those with obesity. Lastly, we looked at the economic and other stresses linked with this pandemic. And we saw a significant increase across the globe in ultra-processed food consumption. That includes both junk foods and beverages. We also saw enormous increase in industry interference. Global food companies and local food companies across the globe giving out junk food to say they're helping feed the poor. It's been quite a huge issue, this whole way the food industry has pushed at this. And we saw that and we looked at that side of the game. And now we need governments to consider how now and in the future they can create these impactful food policies to make the healthy foods less expensive and more accessible, while and certainly cutting down the consumption of ultra-processed foods, which we have from major RC random controlled trial and now close to 30 cohort studies around the globe that have shown these ultra-processed foods are really very impactful on weight gain, on risks of diabetes, hypertension, heart disease, and many cancers. Thank you.
Thanks very much, Barry, and congratulations on that study. If I could ask you a quick follow-up question, could you define for our audience what an ultra-processed food is? I think it's a term that's getting increasingly recognized and used, but for those that maybe aren't familiar, what do you mean by ultra-processed food?
So we mean the foods that have multiple ingredients, usually are industrially processed and have added some additives and smells and other things to make them particularly tempting for people to eat excess amounts. But they're high in sodium, usually high in added sugar, high in the unhealthy saturated fats and in the refined carbohydrates. So they're really a bad sign for all forms of malnutrition, as Jewell mentioned.
Great, thank you for that. I'd now like to turn to Fabio from PAHO. Fabio, Latin America, where you are focused, has been a real leader in implementing promising food policies. Can you share with us a few examples that you feel particularly excited about? What were the policies and what kind of impact are these policies having? And I think the idea here is really to show how these policies and lessons can be translated around the world. So if you can comment on that, that would be very helpful.
Sure, my pleasure. Well, yeah, I think in the reason first why our region and Latin American countries being, at the forefront of innovating policies, really because being seeing how the pressure and the saturation of markets of ultra-processed products in high-income countries were to come and hit Latin American countries ere they get saturated in other countries. So they've started to innovate with very strong policies that can put upfront their obligations to protect adequate food and health. And to start with, I think one of the oldest school meals programs that we have in the world, which comes from Brazil, is a good example on how school settings and other settings have to be reframed to offer children adequate food. And what we've seen in the past years with assessment of the national program, which now benefits more than 45 million people between young children and also adults that did not have the opportunity to learn when they were younger. We have an expansion, and actually we doubled the amount of fruits in the menus that were offered to learners in schools. And also we increase the chances of the ones that are participating in the national program, because the national program is benefiting the learners that are in the public schools. So when we compare private to public schools, we can see there's a greater chance of children benefiting from the school meals programs from having pulses, so beans and fruits and vegetables. And we also see less obesity rates on those that are benefit from the school meals programs. These experience has been shared and with many countries in Latin America, in African countries as well, and it's now in 17 other countries. It also brings us a very important connection between production and consumption. We know that shortening food circuits is really important to reduce cost and also to improve quality of the food that our small-scale farmers are producing and offering to our school children. So this is also a win-win program that brings socioeconomic development as well for the country, which is key for all forms of malnutrition. But we know that not only improving the school environment is not enough by itself, because children go out of school and we need to protect them, and we need to protect also parents and adults, because children learn from adults as well. So one of the things in the other areas that our countries identified as essential to reduce the demand for ultra-processed products are the regulation of marketing, which stimulates not only children, but also adults from which children are learning from, to have and desire more of these products. So if we don't cut that desire and that increase, demand will continue to grow. And the evidence that we have from our best experience in the region comes from Chile, and it says that 40 to 50% of the exposure to marketing of products that are high in have been reduced with the introduction of the ban of advertisement for foods that are high in sugars, calories, saturated fats, and sodium, targeted at children under 14. So that's a huge progress that we've seen. And also the interesting and important example from Chile is that they've managed to coordinate and make the policy coherent between what is being served in schools, regulated in the market, and also applied as a front of pack warning label. So also from Chile, we've learned, and they've pioneered the use of warning labels, as we recognize today as the best policy option for front of pack labeling that meets the purpose of warning the populations about the nutrients that are critical to the diseases that are most burdensome in the region, which we mean obesity, diabetes, and cardiovascular disease, and other diseases that are linked to sugar, saturated fats, trans fats, and sodium. So by applying that, we've seen reduction in sugary beverages, the high-end beverages, even with the first thresholds that they've been using, that's still not the more stringent one. And also when it comes to the impact on diet, the recent approval in Mexico of the warning labels with even more stringent thresholds have already demonstrated with some modeling studies that the impact on diet is going to be huge. And within 5 years after implementation, we'll probably, and we expect to see around 1.3 million cases of obesity reduced, and that would save Mexico around $1.8 billion for preventing those. And finally, from Mexico as well, we have one of the best experience on fiscal policies, because apart from changing the environment, restricting the stimuli of marketing and informing people that those products that are excessive in critical nutrients, we need to make food that we need to promote more affordable, and we need to reduce the affordability of those that are very excessive in those nutrients. So in our region, we have 21 countries that have applied excise taxes to sugar sweetened beverages, which is really a marker of a diet that is promoting obesity. And 7 jurisdictions in the US also have taken that, that step. And the results we've seen in Mexico really showed a sustained reduction with the implementation of 1 peso per litro tax to sugar sweetened beverages, to reduce around 8% of the sales in the first 2 years of implementation. So really good examples from our region, and also a continued exchange of experiences to continue to innovate and continue to meet their obligations to protect and realize the right to adequate food and health. Thank you.
Thank you so much, Fabio. That was really helpful. And the reality is we could probably spend an hour, you know, on each of these policies that you've just mentioned, but you did a brilliant job of summarizing them. And I'm really pleased that you raised tax, because that is increasingly emerging as a policy that is working. And we've seen it now adopted in dozens of countries around the world, you know, the UK, Saudi Arabia, South Africa. And you know, it, from my perspective, is a no-brainer policy that every government should be implementing. And it's a source of revenue, which every country is in need of at this moment. And hopefully that revenue can go back into health programming, including access to healthy foods. I'm gonna keep us moving along because I wanna make sure we've got time for audience questions. Please do send in your questions via the Q&A box or on Twitter using the hashtag VitalTalks. Dr. T, my next question is for you. In July, your predecessor released a powerful statement calling for decisive measures to tackle the global burden of non-communicable diseases, including the adoption of front-of-package warning label regulations for unhealthy foods and beverages. That statement, and I would urge everyone to look at the statement, it's extremely powerful, urges states not to remain passive in the face of non-communicable diseases, and to proactively and comprehensively address diet-related preventable risk factors. Why do you think front-of-package labeling is such a critical intervention for reducing the burden of NCDs?
It's so important, and I know we're talking about, you know, NCDs, and often we don't often put them allergies and allergens, you know, in this group, or the immune response. But I have a very personal experience, you know, being 24 years old and developing severe new food allergies. And as much as I was, you know, a newly qualified junior doctor and I had access to specialist care, it took a year of keeping a diary and documenting all the ingredients in all the food that I was taking, just to try and understand what the allergy was being triggered by. And part of the problem is that we can't make good food choices as consumers if the labeling on food packages is incomprehensible. If people are using industrial coding, that's very hard to, even if you have access to the internet, you can't search to find what it is. So I had to learn about all sorts of coding and try and do research to try and find out what are some of those substances in there. A lot of preservatives, a lot of colorants, a lot of flavorants are also causing some immunological problems, and especially in pediatric patients. But it was actually quite something for myself to experience as an adult who had never experienced, you know, any food-related adverse reactions. But I think I'm just making a point to show you that sometimes, you know, the onset of illness, you know, can be directly linked to the type of food and the type of ingredients that are being used. And the right to information is one right that we can't remove from the right to health, because you need information to make informed decisions. You need information to make to even give consent. And so if the dominant language that's used in food packages, like in places like South Africa, is dominantly in English, what are we saying about the indigenous population and the majority Black population that cannot read English, let alone the industrial coding that a lot of these packages come with? And of course, you know, we have to use research and evidence-based to guide the interventions in order to prevent non-communicable diseases. And it's not even about overburdening the system, because we can't shame people who are then having illnesses as a result of poor nutrition choices, but understand that this is a rights issue. And often when we talk about, you know, lifestyle health conditions, there is that element of shaming people and not really understanding some of the structural drivers, you know, such as poverty, that make it impossible for people to have nutritious food. And it's important for governments to commit to making healthier food more available through social protection. Of course, we talk about the youth, the children in school, but we also have to think about the youth that's out of school. Many developing countries have young people who are not in formal schooling systems, the elderly. We have to think about even the quality of food that's available for inpatients, people who are admitted in health facilities, and what subsidizing of healthy food and supporting the expansion of healthy food production is also related to issues of access to land, issues of displacement, issues of migration. So it's very important, again, just tying the issue of food and labeling and the quality of food to cognitive development in children, issues of dental health, issues of bone health, excuse me. And as I mentioned earlier, you know, the right to nutritious food is one that has to be taken very, very seriously as a major determinant of health. And we know that a lot of these issues are racialized, they are gendered, there's class issues, issues of disability, climate change. All of these lead to certain vulnerabilities and marginalization. And by starting with what it takes to make the most of the most vulnerable among us to thrive, we can build healthier and more just societies. And we would have really, all of us, succeeded if all our efforts and solutions are centered around restoration of dignity, ending poverty and malnutrition, and of course, protecting and promoting the realization of the right of everyone to the enjoyment of the highest attainable standard of physical and mental well-being.
Thank you so much for that. And, you know, you mentioned lifestyle diseases, and if I could just make one plea to our community, it's to stop using the terminology lifestyle diseases, because as you said, it puts blame and responsibility on the wrong entity, which is people, individual people, and removes blame from our food environments and the corporate determinants of health and our neoliberal policies and so on that create the conditions for people, you know, being unhealthy. So that's my personal project, is to get us to stop using the term lifestyle diseases. So Nandita, thank you. You've been waiting so patiently. And my next question is for you, and picking up on front of package labeling. Vital Strategies and the UNC team, University of North Carolina, has just released, it's a hot off the press publication entitled What's in Your Food? A Guide to Introducing Effective Front of Package Nutrient Labels. First of all, congratulations. It's a beautiful report. I urge everyone to look at it. Can you give us some key takeaways from the report?
Yes, thank you. I hope I'm clearly audible. Okay, all right. So yes, Vital Strategies and colleagues at the University of North Carolina released a new report today. And this is really in recognition of the food information environment, just picking off comments made by earlier speakers. Despite public and political concern about unhealthy diets, despite the fact that there's now a significant amount of evidence that links unhealthy diets to a host of diseases, the consumption of unhealthy foods continues to grow. On the one hand, one might describe this as some discrepancy between people's intentions and their behaviors, but in fact, as other speakers have already elaborated on this, it is a result of the environments in which we live. So whether it is the price of healthy foods or the lack of their availability, all of this contributes to a seeming discrepancy. What our report does is highlight one of those sources of one of those factors that affects the behavioral choices people have, and that is in the food information environment, how that promotes unhealthy choices, and that is really the intent of our report, to call attention to it. In particular, our report calls attention to the labels on food packages and how those labels essentially promote unhealthy choices at the point of decision making. Marketers know that most consumers make decisions rapidly in less than 10 seconds. In those 10 seconds, they're faced with a variety of choices, and often decisions are made quickly as snap decisions that rely on peripheral or superficial product features, anything from the claims it makes to the color, the feel, and even the shape of its packaging. Parents in particular are vulnerable to these pressures. Others in the research community have described the pester power of children and the power of that pestering that gets parents to buy products with marketing that target children. So for instance, anything from a cute cartoon animal to a princess. And so ultimately the nutritional value of the product is hidden behind this attractive marketing, and any intentions of the consumer that are well-intentioned essentially fail. But our report also highlights how many of these strategies, these marketing principles, can in fact be applied in counter-marketing to discourage the purchase and consumption of these products. We review experiences of countries like Chile, that's already been mentioned, where explicit black and white, black stop signs essentially warn consumers about unhealthy levels of fat, sugar, salt, or calories. These labels are very cleverly designed. The black symbol stands in stark contrast to the colorful packaging. The clear text warns when there are unhealthy levels of nutrients in that product. And essentially what it does then is it gets people to stop, think, and reconsider their purchases before they make them. And so what is a reflexive action of a busy consumer now becomes purposeful and intentional choices of an informed shopper. And so our guide explains this, the psychology behind the decision making and how symbols like the one that was used in Chile work. But our guide also acknowledges that this is not easy to do. The political prioritization as well as the collective action that is required to enable the passage of bold policies like front of pack warning labels is highlighted. In particular, we call on the different steps that are required to build the momentum for policies such as this. We talk about the importance of working with communities and beginning discussions of what's in our food. The use of media campaigns that generate discussion, debate, and ultimately build public support for examining what's in food and passing policies like front of pack warning labels is something we discuss in our report. We describe the importance of multiple stakeholders coming together, from scientists to policymakers to community leaders to an active and engaged public to drive this policy. We also talk about the crucial role of research and locally generated evidence and the importance of asking the right questions. And finally, we describe the importance of protecting the rights of public health from interference. Chile's experience was incredibly successful. Evaluations have shown reductions in the consumption of unhealthy foods and beverages and the increase in purchases of healthier alternatives. But one of the crucial findings from Chile is the change in social norms. Studies there found, for instance, that children could understand these labels, and in fact, they turned pester power on its head, now demanding from their parents that they send with them foods and beverages to school that do not have the labels. Similarly, the social norms affected market practices. There's evidence from researchers there that products were reformulated to avoid the labels. And so in conclusion, as countries are building up systems to address unhealthy diets in their economies, as new and innovative warning labels are developed, and as other countries look for cost-efficient ways to address unhealthy diets in their communities, there is a significant amount of knowledge, experience, and tools available within the global health community. And so the purpose of our report is this, to bring it all together. The report's available on our website as well as a link at the end of this webinar. And that intent is to bring this information together, to provide it, including the tools from the research protocols to media campaign materials, so that essentially countries can apply what is effective, efficient, and ultimately a free for government behavioral nudge that protects their own communities. Thank you.
Great. Thank you so much, Nandita. And I see that the link to the report has just been shared in the chat. So please do take a look at that. And I assume it'll also be on the Vital Strategies webpage. So look out for it and please share it far and wide. I would like to spend a few minutes on questions that are coming in from our audience. My first question is a two-parter, and it relates to front of package nutrition labeling. I think everybody on our panel would agree that this is a priority policy that governments need to take action on, meaning this needs to be regulated and not a voluntary measure. But often we hear industry say, oh, you don't need to regulate us. We'll put on warning labels or front of package labels. I wondered if perhaps Barry, you could speak to the experience globally with voluntary measures, particularly around front of package, and of course others should chime in too. And then the part two of that question relates to industry. And, you know, obviously in promoting these policies, we are taking on a powerful, well-resourced industry whose interest is in selling these products. So can you talk a little bit, Fabio or Jewell, maybe this question, or Joe, excuse me, this question is for you. What is the role of industry in all of this work that we're talking about? So Barry, maybe over to you first.
Okay, thank you. One of the first things to understand is what we call industry self-regulation, where food and beverage companies, whenever regulations get thought about or starting to be talked about in the policy arena in the country, offer up saying, we will create regulations, we'll go out there and monitor ourselves. And we have dozens of studies now, actually close to several hundred, that have evaluated voluntary self-regulation programs around the world. These can be from something that many of you might see at the bottom of your package called a guideline for daily allowance, a little set of boxes saying how much nutrients compared to some arbitrary reference standard that each company creates their own, or it might be saying we're going to cut marketing to children, which is a very common one, or we're going to ban selling our products in schools or marketing them in schools. And systematically, every study done that isn't connected with the industry has found these practices don't work. What they say they'll do, they put out with great publicity a lot of that, saying we're going to ban this, we're going to do this. But when we evaluate them, and scholars in about every country in the world that have evaluated them have found the same thing. They don't work. They're rarely found to really do much at all. And so that's one of the reasons why we say we need mandatory laws. If we get voluntary laws, they'll put on a label if it's good for them to sell their product, but they won't put the label on if it's bad for them. So the laws that push at warning labels, which essentially are trying to reduce the consumption of the most dangerous component of our food supply, ultra-processed foods. they never will put them on without them being mandatory. They'll put on some others which really don't work. The traffic lights, the Nutri-Score, the guidelines for daily allowance I mentioned, they don't really do much for purchasing at all. They do a lot in attitude studies that they publish all over the place, but they haven't shown purchase impact at all. The same goes to some extent for the positive logo for healthy food, the Choices logo and the tick. They really haven't shown major impacts on purchasing coming with them. The warning label's the only approach that has, and that's the one the industry will fight the hardest. They'll actually push all these other labels because they don't work. Thank you.
Fabio or Joe, could you comment on the role of industry in this work that we've been discussing?
Yeah, sure. So I think the first thing that's very important is not only that we need front of pack labeling as something that should be a priority at the government, but we should be very careful to protect that process from the interference of such industry. Because having a front of pack labeling, even if it's mandatory, but it's weak because it's been weakened and it has been taking a lot of the participation and interference of industry, then you end up with a lot of products that are not covered, or even you have a system that is strong enough, but just a few products are covered. That means you're gonna be increasing other products that are not regulated. And that's there's a very tricky discourse that industry is using to weaken that the thresholds. And that's usually mentioned that we want thresholds that allow us to reformulate. But what actually that means is that we want thresholds that allow us to have more products deregulated. And once we avoid and once we protect that space from their interference, we will be able to establish thresholds that really can bring most of the products that we need to regulate to be regulated. Otherwise, you know, it will seem, and we'll spend a lot of many years with the front of pack labeling that is expected to have an impact, but at the end we won't see that impact because we left a lot of products out of the regulated set of products. And the other issue that we've been facing then, apart from weakening those policies, is also the delaying of policies. So some countries, industry try to ask for 2, 3, 5 years to start implementing front of pack labeling. When they do changes to labeling, sometimes just for a season, just for Christmas, just for specific years or moments of the year, then change back. So we know that most of the changes to the labels are already done for marketing reasons, but they still want to use that argument to try to delay, and they've been using that to try to delay the implementation of something they could do in very quickly. So I think that countries need to be aware of, and we try to help and support them so they can have stronger and get them as urgent as possible in place. Thank you.
Thanks, Fabio. Jewell or Joe, any?
Yeah, just very briefly, because I guess we're also almost out of time, but I think without repeating what Fabio and Barry have already mentioned, I think let's add the child rights perspective on this as well. I mean, when you consider the Convention on the Rights of the Child, it sets out the obligations and responsibilities to protect, respect and fulfill children's rights, including the best interest of the child. And governments have that duty to actually realize children's rights. And I think in these negotiations around policies, it is governments that should be setting the policy objectives and setting the criteria of policies. And it is in countries where governments have taken that leadership that we're seeing the best examples of progressive policies, you know, including front of pack labeling. But if you look at the issue of marketing restrictions to children, for all the reasons Barry talked about, self-regulatory schemes, it's actually governments where there are regulations in place that have been more ambitious on certain aspects, including, for example, protecting children up to the age of 18. You never see that in the self-regulatory schemes, expanding it to other forms of marketing which are not currently covered. So really it is the government leadership and making sure that the process, as Fabio alluded to, make sure that you avoid the conflict of interest in policy making.
Perfect, thank you. I'm going to take one more question before we wrap up, and it's for Dr. T. In low-income countries, as people, as their socioeconomic status improves, we're more likely to see them begin consuming ultra-processed products. How do you have thoughts about how we prevent this from happening? You're on mute, Dr. T.
Thank you. I think it still boils down for me to access to information to make informed decisions in that food aisle when you are shopping without having an assistance of an expert or a dietitian. I think we need to improve the health literacy of all populations generally around issues of nutrition. A lot of ultra-processed foods are very high in sugar and salt and energy, right? But very low in terms of the substances that we need in terms of the micro minerals and the like. And so it's important to talk about the issues of class and what having extra income or having more money means in terms of accessibility and being able to buy fast food. We also have to talk about the fast pace and how getting more money means you are possibly working in industry, you are working long hours, who's cooking at home, because if the burden of household chores and cooking and shopping for food still falls on women. Those who are at home may not be taking the initiative to cook and ensure that the rest of the extended family is well taken care of because the mother has to work extended hours or away from home. So I think there is something to be said about class and access and I suppose what money brings in terms of access. But it's also not just a rich people's disease. You find that in a lot of townships and urban slums where children are actually eating over processed potato chips, right? No one knows the colorants and the flavorants in all of that food, and even childhood obesity, even in communities that are seen to be poor, is also a problem. And I think even in the previous special rapporteur spoke, or the special rapporteur on the rights of indigenous people was speaking especially about issues of accessing land and the responsibility of states ensuring that indigenous communities are able to grow their own crop. Very much the issue of food and nutrition and herbs. It's also related to traditional medicine, where a lot of communities in the developing countries will still rather seek help in a traditional healthcare or a traditional healer before they go to a Western healthcare facility. So the issues of food, access to medicine, access to healthcare are very important because marginalized communities not only have a difficulty in accessing good nutritious food, but even the treatment and management of those diseases that then happen as a result of poor food can't even get the medical resources and management of those diseases too. So we have to talk about it in totality, and we can't remove it, for example, from other rights of water and sanitation, the rights of the environment, right? And not having industry pollute rivers and streams for populations and communities. So it's very important to look at it in totality because there may be things in industry and in how corporates and in how people are working that directly impacts their time and availability at home to then either grow food or cook healthy food and shop for healthy food.
Thank you so much. There's some really great questions coming in. I wish we had time to get to a few more, but we are at the end of the session and perhaps we can arrange a follow-up at some time down the road. I want to thank all of our speakers today for your time, your insight, and unwavering dedication towards promoting nutritious diets through the use of effective food policies all over the world. It truly is a fundamental human right that can impact so much of how we feel and how we live. I'm inspired by all of the efforts of public health advocates and experts around the world who, despite an unprecedented pandemic and well-resourced industry opponents, are making incredible progress towards better diets for their fellow citizens. You can watch the recording of this session and access the front of package labeling guidebook on Vital Strategies website. That's vitalstrategies.org. I'd like to extend a warm thank you to all of our audience for your participation. Again, I'm Nina Prasad. Thanks so much for joining us.